Okay, so you have like physician assistants or nurse practitioners on staff.
Yeah, exactly. So we've evolved over time. So today we have a little bit over 200 clinicians. It's about 80% of them are nurse practitioners and physician assistants. 20% are physicians.
Mm-hmm.
And
Gotcha.
the, yeah, the best way to think about us is like we have our own technology platform we built out for this. But in skilled nursing, it seems like there's usually providers around. There's always nursing staff around, and then there's a physician that usually rounds during the day, a nurse practitioner. They'll be in there during the week. But on nights and weekends, there's very few providers. And if there's an emergency with the patient, say something complex like chest pain, or they fall, or something really simple, even like a lab result comes back or an X-ray comes back in the middle of the night, they need a doctor, the nursing staff, to really look at that and decide, is it safe to keep the patient here, based on those things. And so what they would do is normally make a phone call and probably wake someone up or wake their call service up. And then many times the patient will end up being in the hospital. And so instead, what they do is they walk in with a tablet running the third eye technology, and they hit just one button on it, very, very simple, enter a little bit of data, and then a third eye clinician comes on in 2 to 5 minutes, and we usually average under 2 minutes. And they partner with that nurse at the bedside to try to treat that resident or patient in place and only send them to the hospital if they absolutely have to. And then really cool complex system in the background to route data, route to the right clinician who's licensed in that state, credentialed in that building, and then has all the data they need to make a decision. And we use some algorithms and other stuff to make sure that they have all of that data, and then everyone has access to all of that information.
Awesome. And so, primarily skilled nursing. Any other types of post acute?
Yeah, the bulk is has been skilled nursing. We're in a little bit over 1,100 total buildings right now. Most are skilled nursing, so meaning like the post acute patients that are recovering from surgeries or things in the hospital, and then all the long term care patients that are there. And then we also last year really started focusing on assisted living a little bit more, and we're growing in that
Mm.
space too. So more of the assisted living, memory care has been another great area